Assalamu alaikum warahmatullahi wabarakatuh. Today, inshallah, we'll talk about the pathological process of atherosclerosis. We'll talk about atherosclerosis. In atherosclerosis, we talk about something related to the blood vessels, what's happening to the blood vessels, mainly the artery. And we talk about atheroma. So we talk about two things. In the blood vessels, this, as you know, any blood vessels, this is the blood vessels. It composed of muscular layer and lining endothelium. And below the endothelium we have intima. This is intima. So if we have a cross section of the artery, we have the inner one, we have the endothelial lining. We have the endothelial lining. Sorry. We have the endothelial lining. This is endothelial lining the blood vessels. And after the endothelial, we have the intima. We have this is the intima. This is a intima. So for today, intima is the most important part of the artery. We have to know because when we talk about atheroma, we talk about something related to age, to intima. So this is the intima, and outside we have this is a muscle layer. And according to the artery, it could be have some elastic tissue outside if it is a large artery, or it may be only smooth muscle if it is a small artery. In medium-sized artery, we have some elastic and some smooth muscle. So this is a media of the artery. This is media or muscular layer. So tunica media, and this is intima. Intima is very important for us for today. This is endothelial lining. Endothelial lining, and outside we have a seal layer in the artery. It could be a little bit larger in vein. This is sometimes called cistern or adventitia, or adventitia. So these are the cross section of an artery. We have endothelial inside, and we have intima, we have media, and we have external part. This is adventitia. So this in any blood vessels we have this structure. So in the blood vessels we have most important things when there is an injury, when there is a vascular injury, when there is vascular injury, and this injury, it could be due to infection, or it could be due to immune injury, so immune mediated immune injury. So immune mediated, it could be due to physical trauma, when they use a catheter, arterial catheterization, or something in form of hypertension, because the shearing movement of hyperdynamic. It can also sometimes it can be affected by toxin or toxic exposure. like oxidized lipid. It is very toxic for the blood vessel. Oxidized lipid is that LDL. LDL. It is very toxic. Sometimes cigarette smoking also, it is very toxic to the blood vessel. So all these things, they lead to inflammation. They lead to inflammation because these are injurious agents. They lead to inflammation. They lead to inflammation. So what is the response of this blood vessel for injury؟ يعني لما يحصل injury ايش الريسبونس بتاع البلد vessels to this injury؟ ايش اللي يكون الريسبونس بتاع البلد vessels to the injury؟ So the response, it takes many forms, and many players have a role in this in this injury. So the response to injury. So in the intima, this is the intima. In the intima, there is thickening. There is thickening of intima. Thickening of intima. Sometimes it leads to endothelial injury. Endothelial injury. And if there is endothelial injury, that means this will stimulate or expose the area for clotting factor, and can cause thrombosis or other things. With continuous injury, the smooth muscle of the media can migrate to intima. So some of the smooth muscle will migrate to this intima, and it will lead to formation of sometimes it changes its behavior, and it sometimes lay down collagen. It lay down collagen. So all these response can lead to one thing: is they can decrease the diameter of the blood vessels. Decrease the diameter of the blood vessels, and it also can affect the resilience or the ability to contract and relax for this muscle. So all this will end up with some problem we will come across. So the blood vessels, it can be injured, and the injury in the blood vessels have many response in the intima, response in the media, and also response in the endothelial cell. So endothelial cells. So this will lead to many problems. The most important of them is atheroma. The most important is atheroma. So if we go to atheroma, so this is our most important issue today is atheroma. So we start with definition of atheroma. Definition of atheroma, or sometimes we call it atheromatous plaques. Atheroma are raised lesions composed of soft lipid cores. So if this is a blood vessels, this is an artery, and this is an intima. This is the endothelial lining, and this is intima. This is intima, and outside this is media and adventitia outside, and the adventitia outside. So atheroma, that means there is accumulation of fat, lipid, and necrotic in the intima, which raised in the lumen. So the definition is raised lesion composed of soft lipid core. This is هنجيب عشان نشوف تفاصيل أكثر. So this is a definition of atheroma. So this is intimal mass which grow up until it close the lumen. It close the lumen of lumen of the artery. So this is definition of atheroma. And atheroma, it is very serious condition because sometimes it ends up with rupture. It can lead to thrombosis. It can lead to occlusion of the artery, and it can lead to formation of embolism. All this can eventually lead to blockage of an artery somewhere, either in the coronary or cerebral artery or aorta, and this will lead to ischemia and infarction. If it is in the heart, it may be of grave consequence. It may be of grave consequence. So this is definition of atheroma. So the epidemiology of atherosclerosis and atheroma, the epidemiology of atheroma and atherosclerosis and atheroma. It is occur worldwide. It is everywhere worldwide. It account for 50% of deaths. يعني لو أخذنا causes of deaths, 50% of causes of deaths is due to إيش؟ to complication of atherosclerosis and atheroma. It affect very important arteries like aorta, coronaries, and cerebral artery and cerebral artery. So it is can lead to aortic aneurysm. If there is a rupture aortic aneurysm, this means there is a death. Coronary arteries, all you know about الذبحات أو احتشاء عضلة القلب, myocardial infarction, or all you know about stroke or جلطات اللي تحصل في الدماغ due to this problem of the artery. So the atheroma or atherosclerosis, it is a worldwide condition. It contributes to all diseases by half, is 50%. It's the artery which are more affected are aorta, coronary artery, and cerebral artery. So this is about the risk of the epidemiology of atheroma. epidemiology of إيش؟ atheroma. نشوف شيء آخر عن الأثيروما. نشوف what are the risk factors who are vulnerable to have this atheroma. مين الناس اللي أكثر عرضة للأثيروما؟ الآن it is a very important topic. There is a lot of details about it. A lot of details about the risk factor of atheroma. A lot of details. So this is atheroma. This is definition of atheroma, and we talk about the epidemiology, and these are the risk factor. What are the risk factor? إيش الناس اللي عرضة؟ risk factor, because it is very important. As I said, we divided the risk factor into two types. We have major risk factor, and we have minor risk factor, risk factor. So we divide the major risk factor also into two types. We call it constitutional or non-modifiable. So no way to change this risk factor at all, no way, non-modifiable. And this like age, you can't change your age, like sex, and like familial. So if there is a family history of ischemic heart disease or family history of coronary artery disease or ischemic or risk factor for atherosclerosis, you have to have this risk from your family. So this major non-modifiable, we have major modifiable, عندنا major modifiable, and this is you can change this factor. You can modulate this risk factor, and this risk factor like hyperlipidemia, you can change this hyperlipidemia by drugs, by changing the الفود ستايل والاشياء دي ممكن تعملها. ممكن you can change الhyperlipidemia to be you have a normal lipid in your blood. So hypertension, it is also a risk factor, and hypertension can be modified by drugs, by changing lifestyle, walking, taking fluid with less salt. All this can control the hypertension. Also, we have in the major risk modifiable, we have cigarette smoking. So also you can modify this risk factor by stopping smoking. We have diabetes mellitus. Also can control the diabetes. We have C-reactive protein and physical inactivity. You can walk half an hour 3 times per week, and this is all it can change the outlook of this factor. So these are the risk factor, major risk factors. Non-modifiable like age, sex, familial, you can't change it. We have a modifiable factor like hyperlipidemia, hypertension, diabetes, C-reactive proteins, physical inactivity, you can change it. All this we call it age modifiable major risk factor, you can change it. And we have minor risk factors, and this minor risk factor, it can contribute to formation of atheroma, formation of atheroma, like obesity. So the obese people, obesity, it is a risk factor. For postmenopausal estrogen deficiency in the female. So this atherosclerosis is common in male. يعني الأثيروما والأثيروسكليروsis it is a disease of male. It is common in male other than more than female. But after menopause, maybe the risk become equal between male and female. Yes. So high carbohydrate intake. This is high carbohydrate intake. So like rice, high saturated fat intake, high saturated يعني الكبسة بالمعنى كده يعني تاخد أو لما تاخد ذبيحة مع رز تاكل كمية من الدهون كمية مع السكريات. This is a risk factor. Lipoprotein A also it is a minor risk factor for formation of atheroma. So these are the risk factor for atheroma. Major, non-modifiable, age, sex, and familial. Sex, it is more common in male. Major, modifiable like hyperlipidemia, hypertension, diabetes, C-reactive protein, and physical inactivity. And we have minor like obesity, postmenopausal estrogen deficiency, high carbohydrate intake, high saturated fat intake, and high and lipoprotein A. So these are risk factor for formation of atheroma. نجي لنقطة مهمة جدا في الأثيروما هي الباثوجينيسيس. كيف بتتكون الأثيروما؟ كيف بتتكون إيش؟ الأثيروما. كيف تتكون الأثيروما؟ So الأثيروما we have many hypotheses لكن نحن we talk about one hypothesis here. في فرضية واحدة بتورينا كيف إنه بتحصل العملية بتاعت إيش؟ الأثيروما. So pathogenesis is very important. Pathogenesis. So we talk about response to injury hypothesis. We call it response to injury hypothesis. يعني في فرضية بتاعت إنه there is a minimal chronic inflammation taking a long time up to 20 years or 30 years from يعني beginning to formation of full blown atheroma. Sometimes it takes around 20 years. يعني it starts from age of 18 or 20 and it appears in age of 50, 55. So it takes a long time for atheroma to appear, and we have a minimal chronic inflammation going on from 18 years or 20 years up to age up to 55 and so on. So it is start very early on. This start with what? Number one, we have this is endothelial. This is endothelial. We have this is endothelial blood of the blood vessels, and we have this is the intima. This is the intima. This is a intima, and look, this is a media. Sorry, this is a media outside. This is a media of the blood vessels, and also this composed of smooth muscle. Composed of smooth muscle. These are smooth muscle. And of course we have outside adventitia from outside. So any one of the factor we talk about, so can hypertension, diabetes, or so on, it form some sort of damage to the endothelium. It form some sort of damage to the endothelium. There is a damage in endothelium. What happened بعد يحصل damage للإندوثيليال؟ not like this. يحصل damage للإندوثيليال by this area. There is a damage of endothelial. هل يحصل إيش؟ هل يحصل إنه some of LDL will enter this intima. LDL will enter this intima. So these are LDL which enter the intima. And in this area we have a macrophage. A macrophage start to engulf this. We have this is a macrophage which engulfs this lipids particles, and this will lead to activation of macrophage, and macrophage start to release cytokine. Start to release cytokine to recruit more macrophage from inside. يعني بيجيب more monocyte, and lymphocyte will go to this area to participate in engulfing of this material, and this is lymphocyte. So يبقى المرحلة الأولى بيكون عندنا injury to the endothelial, and after that some macrophage will enter to engulf this endothelium. So we have endothelial dysfunction أو increased permeability will lead to this. اللي يحصل إيش بعد ذاك؟ اللي يحصل إنه this is the endothelial. اللي يحصل إنه in the intima. الانتما شكلها حيكون مرسومة كبيرة شوية عشان يكون شكلها متغير. So this is the intima, and this is media. These are the media. This is the smooth muscle of the media. Smooth muscle of the media. So smooth muscle of media. يحصل إيش؟ يحصل إنه الماكروفاج will come here, and it start to engulf some lipids. Start to engulf some lipid, ويكون عندنا more macrophage engulfing some LDL, oxidized LDL. Sometimes الcytokines اللي تطلع من الماكروفاج will change the behavior of this smooth muscle, and it transform in also engulfing cells. تجي ايش؟ تجي الماكروفيج، يجي الماكروفيج السموث muscle cell to enter الانتما. It enters the intima and it start to engulf some LDL. هي تبدأ to start to engulf ايش؟ LDL. يبقى نحن هنا عندنا two cells engulfing LDL. عندنا the macrophage وعندنا ايش؟ السموث ماسل اللي هاجرت لنا من الميديا، الى الانتما سموث ماسل. These two cells start to engulf ايش؟ to engulf this lipids. Also we have some free lipid outside. إلى الآن محتاج لإيش؟ بعض الخلايا to come to engulf it. So these are lipids here. And this is the lumen of the artery. This is the lumen of إيش؟ the artery. So this process takes زي ما قلنا a lot of times. It takes إيش؟ a lot of times. طبعا بيكون عندنا معاهم الليمفوسايتس بيكونوا موجودين هنا عشان ينشطوا الموضوع، لأنه الإيميونيتي كلها بتعتمد على التي ليمفوسايت والأوركسترايزيشن بتاع الإيميون سيستم هي to just to recruit more monocyte يتحولوا لماكروفاج هي and so on. So this is step 1. We have injury. Step 2, we have macrophage and we have a smooth muscle migrating from the media to the intima, and also it start to engulf some lipid particles. And قلنا البروسيس دي it takes a long times. It takes a long times. This stage we call it fat streak. We call it يعني لما تكون هذه المرحلة اللي فيها just we have macrophage engulfing lipids and smooth muscle engulfing lipid. We call it fatty streak. We call it fatty streak. We call it fatty streak. والfatty streaks appear yellow لأنه يكون فيها more fat. So this is step 1. Step 3. This is step 3. Step 3 اللي يحصل ايش؟ انه مع مرور الزمن this is the blood vessel wall. This is the blood vessel wall. This is the blood vessel wall here. And this is intima. This is intima. And this is media outside. This is a smooth muscle and media. اللي يحصل ايش؟ اللي يحصل انه بعد مرور زمن طويل بيكون بعض الماكروفيج and السموث muscle بيحصل لها رابشر and it form a necrotic area. form ايش؟ a necrosis. form ايش؟ necrosis. And we have around the necrosis still we have some macrophages taking fat. We have some macrophages taking fat, and also we have smooth muscle taking fat here. So this is a fat. So taking fat, and of course also we have some lymphocyte. lymphocyte. So at this time اللي بيحصل ايش؟ بيحصل انه السموث muscle start to migrate to يحصل لهم migration عشان يعملوا لنا wall off this area. يبقى السموث muscle يحصل لهم migration here to wall off this area. This is a smooth muscle, and it's also this smooth muscle will lay down collagen. Collagen, and we have a mass, and this mass will raise and it affects this lumen. It affects this lumen. It affects the lumen of the blood vessels وبيحصل narrowing of the blood vessel بيحصل narrowing of the artery بيحصل narrowing of the artery حصل ايش narrowing of the artery يبقى الارتري هي لو رجعنا للصورة بتاعتنا الأولى هيحصل لنا ايش هيحصل لنا narrowing of the artery يحصل narrowing of the artery يحصل narrowing of the artery by this atheroma formation وغالبا بتكون الأثيروما lined by endothelial cells هي عشان يكون في fibrous tissue هي fibrous tissue around لو ما في endothelial cells هيحصل clotting ويحصل thrombosis وبيحصل blockage. So this is formation when stage 3 we call it ايش؟ we call it atheromatous plaque. we call it ايش؟ stage 3 بنسميها ايش؟ fibrofatty atheromatous plaque او بنسميها atheromatous plaque. atheromatous ايش؟ plaque دي نسميها fibrofatty لانه بيجي عندنا some collagen هي نسميها fibrofatty لانه عندنا some fat atheromatous atheroma نسب للأثيروما بلاك لأنها هي ريز بقت في شكل إيش في شكل ماس لذلك سميناها أثيروماتس بلاك أثيروماتس بلاك والأثيروماتس بلاكس دي بتكون يعني later life الفاتي ستريك in early life والأثيروماتس بلاك بتكون في إيش في late life بتكون في إيش في late life. So this is how atheroma form. First injury of the endothelium with moving of LDL and it became oxidized LDL. It is engulfed by the macrophage and the smooth muscle for long time. After that, there is some changes and rupture of these muscles or release of necrotic debris and necrotic fat with intense chronic inflammation here and formation of fibers. This is a process of healing and repair. Fibrosis around the plaque, and when it is grow up, it will be in expense of the lumen. يعني لما كل ما يكبر الأثيروما بيكون على حساب إيش اللومين تكون على حساب إيش اللومين. It affects the muscle لكن الإفكت الأكبر حيكون على إيش على اللومين. الإفكت الأكبر حيكون على إيش على اللوميس. This is how atheroma form and this is pathogenesis of atheroma. المورفولوجي طبعا المورفولوجي حيكون هو نفس المورفولوجي اللي تكلمنا عنه ما فيه يعني الفات ستريكس ولا الأثيروماتس بلاك حيكون فيها نفس الأشياء اللي ذكرناها الآن. نحن نشوف النقطة الأخيرة في هذا الموضوع. أنا الحتة بتاعت المورفولوجي I escape it لأنه نحن just what we do this is a morphology. what we do this is إيش the morphology. so I escape المورفولوجي. لما نجي بعدين في اللكشر إن شاء الله هنتكلم عن المورفولوجي حنلقى نفسنا ما ضفنا حاجة للكلام اللي قلناه في الباثوجينيسيس كيف الأثيروما بتتكون ما بنكون ضفنا حاجة. نشوف بعد ذاك الأشياء اللي ممكن الكومبليكيشن الممكن تحصل مع الأثيروما. إيش الكومبليكيشن اللي تحصل ليش للأثيروما. نشوف إيش بيحصل للأثيروما as complication. نرجع تاني نشوف this is a blood vessels. Sorry, this is a blood vessels. This is a blood vessels. And this is atheroma here. This is atheroma. This is atheroma. And this is muscle. So this is a smooth muscle. And this is adventitia from outside. This is H from adventitia from outside. So this is endothelial lining. So if we look here ممكن يحصل لنا ايش؟ ممكن يحصل لنا نمبر 1 الموفمنت بتاعت البلد it will destroy this area. it will destroy ايش this area. يحصل ulceration in this area ويحصل this continuity of الابيثيليوم over this plaque. يعني حيكون الابيثيليوم ما هو موجود. الابيثيليوم لاحظوا هنا الابيثيليوم اختفى، بقى discontinuity of epithelium. ودي في النهاية ممكن جزء من المكونات بتاعة الأثيروما، جزء من مكونات الأثيروما، ينتر ذا بلاد، تكون في شكل ايش؟ في البلاد. ودي ممكن تدينا ايش؟ امبولس. ممكن تدينا ايش؟ امبولس. ممكن تدينا امبولاي، والامبولاي في النهاية بينتهوا بايش؟ تدينا ايش؟ امبولاي. امبولاي، والامبولاي بينتهوا بانفاكشن. بينتهوا بايش؟ باسكيميا ان انفاكشن. اسكيميا ان انفاكشن دي واحده من الكومبليكيشن. ممكن يحصل ربشر ويحصل ليك للكومبوننت هي ويدينا ايش؟ امبولس. السكند ثينكس ممكن يحصل لنا ايش؟ ممكن يحصل لنا هيموريتش inside the plaque. ممكن يحصل لنا hemorrhage here. يحصل hemorrhage. This is blood. It will enter here. Hemorrhage inside the plaque, and this will increase the size of the plaque and it will occlude the lumen. لو حصل occlusion of the lumen also it will lead في النهاية لإيش؟ تدينا إيش؟ تدينا ischemia. تدينا إيش؟ ischemia. تدينا ischemia. ممكن يحصل sudden occlusion. يحصل sudden occlusion due to bleeding، ويحصل لها large، ويحصل لنا تدينا ايش؟ اسكيميا. يبقى ممكن يحصل ulceration rupture ويدينا impulse. ممكن يحصل hemorrhage inside the plaque، والبلاك يزيد في حجمه بصورة كبيرة والصدى اللي زيادة ويعمل لنا يقفل لنا ايش؟ يقفل لنا الارتري ويدينا ايش؟ اسكيميا. ممكن لو رجعنا شوية ممكن يحصل ايش؟ لو حصل اكسبوشر للابيثيليوم ممكن يحصل ثرومبوس فورميشن. ممكن يحصل لنا ايش؟ ثرومبوزيس، لانه هيجي البليتليت والفيبرين يكونوا ثرومبوس، وكلوتينج ثرومبوس 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 الين يحصل لنا ايش؟ كومبليت اكلوجن الى الارتري. ممكن يحصل لنا ثرومبوزيس. ثرومبوزيس وفي النهايه برضه بتنتهي بايش؟ باسكيميا. تنتهي بايش؟ باسكيميا. الاوكلوجن ينتهي بايش؟ الاوكلوجن ممكن ينتهي بايش؟ بالاسكيميا. يبقى الاوكلوجن ينتهي باسكيميا، والامبولاي تنتهي باسكيميا، والثرومبوزيس ممكن ينتهي بايش؟ باسكيميا. كلها ممكن يحصل فيها اسكيميا. sometimes لو الامبولس جلس الزمن طويل وبدون اي تغييرات ممكن يحصل فيها dystrophic calcification. ممكن يحصل فيها ايش؟ dystrophic calcification، وبيبقى شكل الارتري very hard and it likes a bone. it likes ايش؟ a bone. it could be like ايش؟ a bone. الحاجة الأخيرة ده كل الأشياء اللي اتكلمنا عنها، يعني ممكن قلنا dystrophic calcification يحصل تكلس. ده كله بيكون ايش؟ towards ايش؟ towards الاندوثيليوم and towards the lumen. يعني سواء كان الامبولاي او الامبولاي ثرومبوزيس or occlusion or dystrophic calcification كلها it affect ايش؟ it affect the lumen. في حالات نادرة جدا ممكن الامبولس ممكن الاثيروما it affect ايش؟ المسل. it weaken the muscle. المسل it become weak and this will lead to what we call it aneurysm. ممكن to lead to ايش؟ to aneurysm. aneurysm ممكن to lead to ايش؟ to aneurysm. So we have 5 complications: emboli, thrombosis, occlusion, dystrophic calcification, and number 5 we can have ايش؟ aneurysm. والانيوريزم ممكن يحصل له ربشر. لو حصل له ربشر بيحصل في ماسل بليدنج، والماسل بليدنج في النهايه بيدينا this. So this is it is not brief, it is a long time, it is almost 40 minutes about atheroma. We talk about what happened to the blood vessels when it injured, the response of the blood vessels to injury, and also we talk about atheroma, definition of atheroma. We talk about epidemiology of atheroma, and we talk about risk factor for atheroma. A risk factor, we divide the risk factor into 2, major and minor, and we divide the major into modifiable and non-modifiable. We talk about the pathogenesis of atheroma. This is the most important area. And in the end, we talk about complication of أثيروما الكومبليكيشن قلنا ممكن تكون امبولس فورميشن، ممكن يحصل اوكلوجن، هيموريدج ويز اوكلوجن، ممكن يحصل ثرومبس فورميشن، ممكن يحصل ديسكروفيك calcification أو يحصل لنا انيوريزم. Thank you very much indeed.